Hi, this video is the before and after hair transplant restoration surgery by me, Dr. John Diep. We did the surgery around a year ago, and we did around 1,500, right? And so the patient has a receding corner and in the middle. So what I did was we did the FUE method, and as you know, FUE is follicular unit extraction. That means harvesting one follicular unit at a time, and so that way we leave tiny dots of scar in the back of the head, allow you to wear your hair shorter. This patient, when he came to for my consultation, he mentioned deliberately that he liked to wear his hair short and he does not want anybody to know that he had any surgery, so he does not want to leave any scar. And in the front too, if the density is good, then that will allow him to wear his hair shorter. So before we go further, I want to show you his before and after. And you can see how bald he was. And that was him before. And this is him now. What excellent density. Very natural. And that was before. And this is now. And then we can go one more. For you to see. This is before, on the right side, before, after, right side, before on the left side, after on the left side. And this is what he is right now. And I want to tell you, leave his hair so short that you gotta understand that to have the best, good, excellent density, to allow you to wear your hair shorter, you need very good density. And so he cutting around to what, 2 centimeters, small like this one, and we left his hair very nice and short. What we did, we filled in all the way one corner and all the way in this corner. And for more information, you go to my website at www.mhtaclinic.com, click on before and after icon, or call 1-866-999-6482. Getting back to this patient. And I would like to tell the audience that hair transplant is an art form, and FUE, hair restoration surgery, is an art form, and it requires a lot of artistic and aesthetic details to ensure a natural result. So a lot of video I told about the before surgery, and this is one of the video. This is the after one. We got to talk about how to create the hairline that's specifically for each individual ethnicity and each individual facial structure. Number one, from the eyebrows and up, on average for Asian, it's around 6.5 to 7 centimeters. For Caucasian, from the eyebrows and up, is 7.5 to 8.5. For Hispanic and Middle Eastern and so on, it's around 7 to 7.5. Now that's average. It's not everybody going to be exactly the same. I built the hairline not only depend on the facial structure, on the ethnicity, but the overall facial structure too. If you have a longer face, for the average, it might be too short. If we stick with 6.5 to 7, so we gotta raise the hairline up a little bit. If the facial structure a little bit more shorter, narrow, then if you keep on the average, it might be too high, because on average, if you look at the face, it's around a third. From the hairline to the eyebrows, a third. From the midpoint of the eyebrow to the tip of the nose, a third. And the tip of the nose to the chin is a third. That's just average. Just like look at the picture of Mona Lisa. It's a third and a third. And the way they draw is she looks almost, the measurement almost exactly like that. So it doesn't look very, I think it's not a real person because it's too perfectly symmetrical. And so my goal is trying to have an average like that. And you know, it's an art form, as I mentioned. A lot of other clinics, they talk about mature hairline. I say yes, I agree, but then the mature hairline doesn't have to start half of the head in front. It doesn't make sense because you have a big giant forehead and then with a lot of hair. So we have to do the hairline that is perfectly natural for a certain facial structure. You don't want to do too low where it looks abnormal. And this patient, the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline. But this patient's face is semi. He's in between. So he's actually curved up like this. And I follow the natural pattern. And so then you can see how how it's the softness in the front, single hair graft in the front, follow root by go 2 hair, 3 hair, and 4 hair in the back to have broken volume. The back is broken volume, but the front is for softness. So single hair. The angle of the hair is very important. Now imagine if he leave his hair short and the angle is wrong. So starting here on 35, 45, increase when you go backward and change it when you go sideways, and it sweep through that way. The angle really determines your overall face and all this stuff. This guy's face completely changed, even though just subtle changes like this. And I'm very happy with the result. And of course the patient is very happy with the result. He's even went on blogs and really, you know, he does not work for me. What he does was just trying to share his experience and saying that, hey, hair transplant works, and you know, you have a chance, just go on his blog and find out. And you can see his before again. That's before, and this is afterward. And his blog is can you hear me now? Something like that, right?
Can you hear me now?
Yeah, and that's I love that title too. But anyway, go listen and read more about his experience. You can even contact him through that, and then he can share. And again, I want to emphasize that the patient doesn't work for me. He does this because he believes in my work, and that he does not want people to make a mistake in choosing just anybody who over advertisement. Because hair transplant is an art form. FUE is an art form, and you know, I invented my own tools, and by inventing my own techniques to do the hair transplant. And recently, the newest technique called the DFC is the Diep FUE Curve technique, specifically to harvest black curly hair. Now, straight hair is already hard, but if the surgeon can do the black curly hair, that's even harder to do. And so because of my new technique, we can harvest the black curly hair more than 1,000 root, on some patients even 2,000. Thank you.